It's Dr. Karthik Ram. Welcome to my podcast. I'm a board certified plastic surgeon and educationalist based out of Chennai. I'm really honored that you have taken your time and given me your gift of your attention. Hope you are going to love this session. Please follow me in my Instagram handle for more updates. My Insta handle is Ram Dr. Karthik, RAMDRKARTHIK. Enjoy today's podcast. Is liposuction worth? See, when I started my career 11 years back as a plastic surgeon, and like in India, very common belief is if I gain weight, I'll go for liposuction. I used to see a lot of patients like this, and I have treated a lot of patients like this, and I've seen a lot of sad stories as well as very interesting stories in my practice in the last 11 12 years. I'm going to share a few of the stories to understand the pros and cons of the liposuction. A girl from Pondicherry, she's an engineering college student and she wants to reduce weight. She tried a lot of things, nothing worked. See, whenever people say that I tried everything and it doesn't work, that means I know very well that they haven't tried properly together. Sometimes they do, like exercise, sometimes they do only dieting. They never combine both, or they won't be consistent in their weight loss journey. So this girl come to me asking, saying that, doctor, I tried everything. Please do something. Like mother also accompanied her. She has a PCOS problem and she has a lot of other comorbid like a thyroid, just to give shape to the body. She said, you reduce these areas like arm, tummy, upper back, lower back, thighs. I'll reduce the weight and make it happen. Please do the help. Mother also insisting that because they're planning to look for alliance. So we did a liposuction and we removed almost 11 liters of fat from the body, and she's extremely happy, and she lost a lot of weight and maintained the weight so much, and mother is also happy. But after, like these guys follow me in my Facebook and Instagram, and like they keep sending messages about the progress. I told her no liposuction afterwards, you have to do dieting and exercising only. That's the only solution for you. But she told, doctor, this is a mother also begged me saying that this is the last thing, please do something about it, because another 2 months she's getting married. So again I did liposuction, and I made her, like most of the areas, all these fat deposits I removed, and she lost weight to the extent she's okay for the marriage. And after 3 years I saw her photographs. I was so much shocked to see it. She again put on weight. I was really depressed to see this kind of my post liposuction patients, and I myself doubt whether am I doing a correct thing or a wrong thing. So always understand liposuction is not a weight reducing procedure. It's not a shortcut for your weight loss journey. This is the message I can give you from this story. I'm going to tell you the second story now. She might be, like 10 kgs overweight for her height, and otherwise a pretty girl, and she wants to go for liposuction of the tummy and the back, lower back. I told her all the pros and cons of the liposuction. She understood, and I did a liposuction of the tummy and back. Her parents are living abroad, so she flew back after the liposuction. After 10 days, she flew back after the suture removal. I have not seen her for quite some time, maybe 2 months. After 2 months, I received a call in the middle of the night saying that, Dr. Karthik, you spoiled my life. I wasted my money. There is no results in my liposuction. And I like middle of the night, I was shocked because I did my best to give a good shape to her. So I asked her to come for a review. So she came back, and I asked her what happened. She told after 2 months she went for a pubbing, and all the friends say that, why you gained weight. So it happens a lot of times. People think that doing a liposuction alone give them a wonderful appearance, and they kind of everybody appreciate the results. Actually not. The area where we do liposuction alone looks good. If you want to shrink overall, only dieting and exercise helps. If you don't understand, the client won't be happy. So what I did is I took a picture that time. I posted I showed her the before after pictures, and she was extremely confused because it's a wonderful results. If I want to convince any of my patients, I can show that results and everybody get convinced. It's a beautiful results. Then she got confused why her friends telling that you gained weight, because after liposuction she thought it's everything is done and I don't need to do anything kind of. So she hasn't followed any kind of a basic diet or exercise. So she gained few kgs after liposuction. So that area looks good, but overall she hasn't shrunk. Obviously, nobody can appreciate the changes unless otherwise they lose weight. So again, I'm telling you, liposuction is not a weight reducing procedure. It's a body contouring procedure. You won't lose much weight. So obviously, you should not think that it's going to completely change your shape. It's a change the shape in the area where we are doing a liposuction. So unless otherwise you lose weight and come into the ideal weight spectrum, this won't help. Then what is the use of liposuction? A lot of people ask. See, when you're doing diet and exercise, some areas are not responding to your diet and exercise, that is always stubborn to go. That is the area ideal for liposuction. If you go for that indication, you'll be definitely happy. A lot of times people come and ask me, doctor, I'm getting married in a month time, please do liposuction. I tell them clearly, if you want the faster results, you have to do diet and exercise. If you want to slower results, go for liposuction. People can get confused because if you do dieting and exercise every week, you see changes, and if you do liposuction, initially a lot of swelling will be there, a lot of like that sedentary period. Initially you have a lot of pain and you can't do much exercises, like that swelling and all keep disappearing only after few months only. So if you want a quick fix results, you have to go for a weight loss by dieting and exercise, not the liposuction. One more interesting story. She's Anglo-Indian girl from Chennai, and she came for a liposuction consultation. She's maybe at 10 to 15 kgs overweight, chubby girl, and otherwise healthy, and very very happy family. And like mother is asking doctor, she's getting married soon, maybe in 2 3 months. Can you do me a favor? I want her to look good in the photographs, and but the guy is very slim. Please do something. So what we did is we did a problem areas like always I ask them, see, even if you lose weight, which areas won't respond to diet and exercise? They say tummy, outer thighs, like they mention the area. So we combine a lot of areas: thigh, upper back, lower back, tummy, arms, and all one sitting. She was extremely happy with the results. After that, we put them onto the weight loss programs, and that is one of my best results, I can tell you. Even these photographs are in my website. So she was very happy, got married. We all went for the marriage, and whole team, our CPS team, went for the marriage, and very happy couple. And after surgery, they flew back to US. The couple went to US because the guy is working there, and she's also working. She also found a job there, and she was working there. And after 2 years, I got a call from her, and I'm extremely happy to like she's a very very good client of mine. I'm very happy to receive the call from her. And but the message what I got, it is not a good message. She told that I gained 15 kgs back, doctor. I won't look good at all. Can you do me something? I'm coming back for a holiday. I'm coming to India for a holiday for 15 days. Do something for me. I saw her. She gained every areas of the body. So I told her definitely liposuction is not a choice now. You have to do a proper diet and exercise. So I advised her what are the things she has to do, and again she started following those things, and to the extent she manages the weight. But again, after 1 or 2 years, again she came back for the holidays to India, and I thought she went into obese spectrum, morbidly obese spectrum. So I advise, see, either you have to control your diet and exercise in like consistently you have to do it, or think about the bariatric surgery. Finally, she ended up in a bariatric surgery only to maintain the weight and lose weight. See, I always feel bariatric surgery also not the solution for the only weight loss. Even I can see people going for a bariatric surgery for 15 kgs weight loss, and like 20 kgs weight loss. Even I have seen people who lost 70 kgs without doing bariatric. Like end of the day, if you're not changing your mind and you're not like ready for the weight loss journey or the fitness, like wanting to be fit, obviously none of the procedures will help. Just for looking good and for particular instances, don't do this kind of a procedures. If you're willing to maintain the weight throughout your life, or wanting to be healthy throughout your life, attempt these kind of a procedures. Otherwise, don't even come and meet us. It's so much depressing to see our clients gaining weight back after the liposuction. Then, whom this kind of a procedures will help? I know a girl. I know like a middle-aged lady. She is from a very affluent family in from Chennai, and she came alone without anybody family's knowledge, saying that, doctor, you don't believe. Every day I work out at least 1.5 hours to reduce my thighs, but it never goes down. Almost 20 years I am doing this exercise, and I am fed up. Then only I am meeting you. My family never agree further. Do something. So examine her. Yes, it's a lipodystrophy of the lower body and a lot of fat deposits in the lower body. Upper body looks completely normal. So these kind of people, definitely liposuction helps. So we did liposuction of the thighs and the buttock, around the buttock region, outer thigh, inner thigh, around the knee joint, to produce a knee gap, and all those things we did to make her happy, and she got extremely good results. An extremely happy client. Almost 5 years I am seeing her, and never she gained back in the weight in that area. If you have a, it's same lot of examples like this. One college professor, she has a abnormally huge thighs and buttock, and we removed 13 liters from only from that area. She's extremely happy with the results, because this is a, like, she doesn't even know there is a solution for it. That's the other sad part. So these kind of a lipodystrophy, the liposuction definitely helps, and definitely they can maintain their weight, and it doesn't mean, like, this is not the kind of stories what I shared earlier. These clients are in my regular follow up. They are maintaining their weight, and they are extremely happy with the shape what they got. And one more actress, she's very leading actress, is in actress in Tamil Nadu now, and she used to have a huge arm when she started her career. Her whole body looks thin except the arm. So she contacted me through a common friend, and I explained about the procedure. We did an arm liposuction for her. Till today, she's maintaining her arm shape, and she's happy client. So when you do dieting and exercising and you don't lose weight in particular areas, you are very very ideal for liposuction. And whom else got get the whom else benefited by the liposuction? One more actress, two more actresses I can say, and they are all early budding actresses, but they won't get proper chances, because their tummy looks little big, and there is no shape to the tummy and lower back. Like these people, they struggle a lot to do regularly. They go to gym, they do dieting and exercise, never get the shape they want. It's not that they tried, like 1 month or something. They tried few years for the, like down the lane to get the shape. It never happened. Sometimes it happens in the body, like all the body won't be same. Some people won't get a very good result by dieting and exercise. Some people struggle to get the shape. Since they're actresses, obviously they need a very good shape in the screen. In the screen, if you look very thin only, the screen looks, like kind of okay. If you look a little bulkier, definitely you look more bulkier in the screen. So we usually do, like two-pack creation for the females, and like make the hip bone more prominent, and we create a curves properly in the sides, and the lower back we create that, like the paraspinal muscle borders very very neatly, so that the midriff looks very neat and very aesthetically pleasing, and it's a screen ready. So these two girls, it completely changed their career, and like they got a very good offers, and these two girls got like become very famous after the surgery. And I'm not happy about these girls too, because after some time, like they got married, they got pregnant, and completely lost their shape, and they are not ready to uh, like start the regular dieting and exercise. They went to a from a heroine to they become a serial actresses and mother role and those kind of things. uh, I don't know whether these girls doing these girls at that time helped her. Yes, definitely it helped them, and they got a very good offers. But long term, I'm not happy about these girls too. People ask me, then why you do liposuction for even obese people? Sometimes we do, like I do only for one indication. They are young, they're planning to lose weight, but like they don't want to go for a all skin excision procedures like a tummy tuck, thigh lift, or a arm lift because of the loose skin. When we do liposuction, then when we make them lose weight, the skin tightening effect is very good. And post surgery, we put them onto the pressure garments and skin tightening medications along with the liposuction. They won't get much loose skin after liposuction because of the weight loss. So only that indication I take them for a surgery. And one of my client, he's 130 kgs. I did liposuction of the tummy, back, and the thighs, and the chest. Because he has a man boobs also, we corrected that also, and he lost a lot of weight after surgery. Not because of the surgery, he like he did that regular dieting and exercise, and he lost a lot of weight, and he become very much fitness freak after that. And like he participated in a lot of marathons. He came down to 80 kgs, and in fact his sister also came for the surgery for the breast reduction and tummy liposuction, the back liposuction, and whole family is like went into the fitness, and they completely changed their life. Some people, they follow all those things seriously, and like liposuction changes their life. Yeah, if you properly guide them after surgery, if you tell them that it's a solution for you, definitely they'll end up in a very very sad story, as I said earlier. A lot of people ask me whether skin get tightened because of liposuction. Yes, skin get tightened very much after liposuction, because when we pass the liposuction cannulas through a small hole, it goes into multiple levels in multiple directions, and so it creates a lot of tunnels in the subcutaneous plane in between the skin and the muscle. These tunnels in the healing phase shrink and pull the skin back towards the muscle, so that what happens is skin get tightened very well. So you can't expect a skin tightening like a tummy tuck or like arm lift, thigh lift kind of procedures, because there we excise the skin and stitch it, but it gives a very big scar. But in liposuction, to the extent skin get very much tightened, you expect after removing this all the fat, skin looks very saggy. Definitely not. Almost 50 to 60% of the skin tightening happens with the liposuction itself. So if you want a minimal skin tightening with the like fat loss, obviously liposuction is a good procedure. In Indian clients, the problem is if they lose weight, and if they get a lot of loose skin, giving the tuck procedures leaves big scars. The scars won't good in an Indian client, darker skin individuals like us, and so obviously it is not a very very welcoming procedures in most of the darker skin people. So those people, liposuction is a good choice to tighten the skin to the extent. One more girl recently operated. She's from the Middle East, and she keep calling me and inquiring about the liposuction of the whole body. I told her it's very painful procedure, and a lot of side effects are there, like a lot of bruising, redness, and a lot of other stuffs. She said, "Doctor, I want to lose these areas because I gain a lot of weight." I told her it's not a weight losing procedure, just a body contouring procedure. If you want to lose weight, only reason I do is for the skin tightening aspect. I explained everything to her. She understood all the pros and cons of the procedure, and she came for a surgery a few weeks back, and I asked her why you selected me. I know that she contacted a lot of doctors because she herself told me in the middle of the discussions, and I asked her why you selected me. He said that none of the doctors said you have pain and you have these kind of a complications. Then I did a research, and then I realized you only told me all the possible complications. So that's why I selected you, kind of. Yes, post surgery she suffered with a lot of pain because multiple areas. Even I attempted cough because cough was looking very very abnormal. So cough, thighs, upper back, lower back, tummy is lot of areas. When you combine lot of areas, pain will be more. because every area is even a little hurt, you become demotivated. But since I explained her everything pre-op, she understood the, like the pain part, and she manages the whole procedure well. And yet swelling hasn't disappeared. Sometimes thigh swelling and all takes 1.5 to 2 months to completely disappear. The overall results I expect only after 3 months. So now I advise her to follow the regular diet and exercise. Like, to overall it has to help the younger kids like her. Sometimes education also plays a major role in making them understand the pros and cons. One guy is not literate. He's like subordinate of a minister. He hasn't educated much. So he came. He's obese now, almost 110 kgs, and he's 30 kgs for 35 kgs overweight for her height, for his height, and he has a man boobs and a grade 4 gynecomastia actually, and grade like tummy fat and the lower back fat and the love handles. So I explained all the pros and cons. He said, "No problem, no problem. You do the surgeries. I know what I know, kind of." So we did a whole thing, and the grade for gyno here that time, like I'm saying 7 years back. That time we don't have this kind of a advanced technique what we found out recently for the grade 4. So he has a little loose skin, and this are all explained earlier to the patient, but he has not listened properly. He has not understood the pros and cons properly. So he was little unhappy about the results, and I keep explaining, wait for 6 months. If needed some skin excision procedures, we combine to have good results. One day when I came to the hospital, in the clinic in the early morning, and I saw one policeman sitting in the reception. I was wondering what is the policeman doing here. Then I realized inspector called me to the police station. I was wondering what is the heck. Why should he is calling me? I asked, no one complaint is there against you. I though these cases should not be like inquired in the police station, because they don't have any role in this, because it has come from the medical council or a consumer forum or whatever. These guys, I don't know, known to police or something. So he influenced the police because he's working for the minister, no. So he influenced the police, and sent me the police constable to my center. So I went there. This guy sitting and asking for a compensation, saying that it is not done well. so like a lot of interesting series. Then what happens, I spoke to the inspector, and like it's always in India, it's very common. So I spoke to the inspector, and I also have to influence something to make it settle. And I called the guy. See, I definitely wanting to help you. If you do, I also told you after 6 months, I wanting to help you by removing the excess skin and making it little more tighter. Then he said, "Sorry, doctor, I really did the mistake. Do something, kind of." Then I called him, and I did a like mild revision surgeries to tighten the skin, and he was extremely happy. Like sometimes we can't blame the patient if all the patients are not same, but there is nothing against you personally. You have to understand that. So we made him all right. He's very happy client. He keep referring a lot of patients to me after that. Like that's how our patients are. So don't take it anything personal or serious when like something happened this way. Understand why they are doing, and try to help them the way they understand.